Walking corpse syndrome.
Whoa.
It's called Cotard syndrome. It's a
Cotard syndrome. Yes.
Cotard syndrome, a
Yeah.
neuropsychiatric disorder related to depression.
Scary.
This
I am
syndrome
a
makes
walking
people
ghost.
believe that they are dead or missing their soul, organs, blood, or specific body parts. This syndrome is
My
usually
spleen is gone.
a symptom of another psychiatric condition rather than a disease of its own. Symptoms include attempts to self-harm, becoming speechless, delusions of immortality, delusions that one is dying dead or no longer exists, insensitivity to pain, patient stops speaking, refusal to eat, severe depression or sadness, voices telling the patient that he or she is dead or
Oh, my
dying.
goodness. I like the idea that they think that they don't exist, so they, peer in people's windows. And you cannot see me, like kids do when they cover their heads and because they can't see you, you can't see them.
Yeah.
So is there a treatment for that?
Symptoms are usually managed through medications like antidepressants, antipsychotics, anti-anxiety drugs, and therapy like cognitive behavioral therapy.
Yeah, there's a little bit of a pattern there, isn't there? Cognitive behavioral therapy is the bomb.
Very important.
ECT is also used as a last resort.
Okay.
Now, there are people who have strokes who have what we call neglect of one side of their body. And let's say they have a left brain. Well, let's use a right brain stroke. It'll work a little bit better because a severe left brain stroke very often will affect speech. So if you have a right brain stroke, that person will have left body weakness, and they may always look to the right and never look to the left. And then if you pick up their arm, they'll say it's someone else's. They feel it's disconnected from their body.
Yeah.
And but that's different than this. This is interesting. Right here for Cotard syndrome, combination of medication and talk therapy like cognitive behavioral therapy. Very good.
Very good, Taste.
Give thyself a bell.
Suck it.
Damn it.
All right.
Okay, let's do one more, and then I'll
Okay.
save the rest of these for next time.
Okay.
Foreign accent syndrome. Now, we have a friend who has this after she has several glasses of wine.
Right. Let's just say her name, I don't know, is Susie. And when she gets really wasted, they call her foreign language Susie. But it's because
What's her accent? What does she speak? Like, French or is it?
that like that.
Oh Jesus!
Yeah.
So it's not French or
No,
British
it's just
or
drunk accent.
is it Australian, mate.
It's
That would be
hilarious.
kind of funny.
So
This is something slightly different than that.
it stems from a damage in the part of the brain associated with speech. This happens when a person suddenly wakes up speaking in a different accent. It is commonly caused by stroke, trauma, tumors, and or other neurological conditions. The most common treatment would be speech therapy to help a person bring back their normal speaking ways.
Which you can do. You can teach somebody an accent. Let's see if we can find an example of foreign accent.
That is so bizarre, isn't it?
And the thing is, the myth is they wake up speaking a language that they didn't know before. That is bullshit. That's not happened. A stroke can't imbue your brain with circuits that were never there before. It can only take away circuits. So, I think we played this Texas mom that spoke with a foreign accent before. Let me see. Let's try this one. This lady, here we go.
It asked, "Where are you from?" Because of my accent.
It says Judy has foreign accent syndrome. Oh, see, this is
just music.
yeah,
That's
it's
nice.
just music. It's
Nice
just
and
showing her
pleasant.
draw. It's like she just didn't have a problem with drawing foreign things. Let's see. Let's try this one.
6 months ago, jaw surgery to fix an overbite changed Lisa's speech too.
I thought she was playing around with me. I thought she was joking with me, but then she showed me that the doctor had told her she was diagnosed with foreign accent syndrome, and she searched it, and then I was like, oh Lord.
Houston Methodist Sugarland Hospital.
Okay, let's let her speak.
Kitten,
they think I'm talking about a baby cat, and I'm not. I'm saying I'm just kidding, but it's kitten.
Okay, interesting. Well, anyway, all right. We might get a strike because that was CBS News, but it's fine. I'll just mute it and say censored by CBS News, like we did when Philip Glass censored an example of circular breathing that I posted.